We would like to introduce you with causes, symptoms, prevention and rehabilitation of obesity.
Definition of obesity. Obesity is often described as energy balance equation, or in different words, energy intake is higher than energy expenditure, but leads towards energy imbalance and excessively stored body fat. According to Philip James 2004, there is a progressive increase in obesity levels worldwide and in countries such as United Kingdom, Japan, Brazil and United States. For example, in US, according to Caterson et al. 2002, 25% of females are classified as obese and 20% of males are also classified as obese. In United Kingdom, obesity levels are less in comparison to US. It's 24.9% of all population. However, it is 1 in 4 of British adults who is obese.
Some of the causes of obesity are too high calories intake and too low calories expenditure. The average physically active man needs around 2,500 kilocalories per day, whereas healthy woman needs 2,000 calories per day. However, nowadays people seem to consume double or even triple amount of recommended calories, what leads towards energy imbalance and stored body fat. Another cause of obesity is physical activity, which is decreased, and sedentary lifestyle. Obesity does not happen overnight. It is developed through a long period of time as a result of poor eating habits and lifestyle choices, such as too much processed food that is high in fat and sugar, drinking too much alcohol. People often do not realize that alcohol contains a lot of calories. Eating larger portions that an average person needs, drinking too many sugary and carbonated drinks and not enough water. One of the causes of obesity is genetics. Some people used to claim genetics for being obese, which in truth is true. Genetic conditions that can cause obesity are rare Prader-Willi syndrome, which causes a constant desire to eat and feel hunger. It might be true that some genetic traits are inherited from relatives, such as having a large appetite. However, in this case, to lose weight it might be difficult, but it certainly does not make the task impossible. And the last but not least cause of obesity is medical reasons. Some medical reasons can cause weight gain, such as an underactive thyroid gland, where thyroid gland does not produce enough hormones but causes a weight gain, as well as a rare Cushing syndrome, which causes the production of steroid hormones in the body, such as cortisol, and that could cause as well increased weight.
Symptoms of obesity. Obesity affects on the lung functions. This effect reflects in the shift of the balance of inflammation and deflationary pressures of the lung due to a mass load of adipose tissue around the rib cage and abdomen and in his visceral capacity. There is an exponential relation between BMI and FRIs. Also, obesity has been linked to cancer of the colon in the man and woman, cancer of the rectum and prostate in a man, and cancer of the gallbladder and uterus in a woman. Obesity may also be associated with breast cancer, particularly in the postmenopausal woman. Fat tissue is important in the production of estrogen, and prolonged exposed to high level of estrogen increase the risk of breast cancer. High blood pressure. Hypertension is common among obese adults. The risk of developing high blood pressure is also high in obese people who are apple-shaped, central obesity, and then in people who are pear-shaped. This is mainly in the hip and thigh. Diabetes occurs when a body doesn't produce enough insulin to function properly, or the body cells don't react to insulin. This is known as insulin resistance. Prevention and rehabilitation of obesity. There has to be adapted to each client individually according to their goals and risk profile. Nutritional counseling should be offered individual or in groups, and it has been reported that group sessions are more effective than individual sessions. To reduce body weight, it is advised to reduce food consumption by 500 kilocalories per day. It can be achieved by reduction of fat or carbohydrate consumption or both. With 500 calories per day reduction, client will lose up to 5 kilograms per week over a period of time from 12 up to maximum 24 weeks. Increased exercise and physical activity can help to lose weight as well. According to Berth et al. 2014, effective weight loss occurs with more than 150 minutes exercise per week with an energy consumption rate of 1200 to 1800 kilocalories per week. Strength training alone is not effective for the weight loss. However, regular aerobic exercise training, such as ergometer cycling for 30 to 45 minutes 3 times a week, increases cardiorespiratory fitness, decreases cholesterol and hepatic lipid levels. Interventions for behavior modification. According to Berth et al. 2015, group or individual setting interventions should be included in the rehabilitation program. They should be aimed at change of lifestyle, nutrition, and physical activity levels. If a patient experiences morbid depression, motivation problem, or eating disorders, which also can be caused by obesity and overweight, a specialist such as psychiatrist or psychologist should be involved. Weight reduction program. This program should combine all listed factors such as diet, exercise, and group or individual behavior intervention sessions that should be adapted individually to each patient. Weight loss drugs such as orlistat is prescribed to clients who are at risk of becoming morbidly obese. It's been reported that drugs such as testosterone, thyroxine, diuretics, or diet supplements are not recommended for weight loss due to high associated risk and lack of evidence of their effectiveness. Surgical intervention in extremely obese patients. Surgery is considered to be the most effective treatment in fat reduction, decrease of obesity, later diseases, and risk of mortality. Prior to surgery, patients' metabolic, cardiovascular, psychological, and dietary details are assessed. In conclusion, obesity causes a lot of physiological and biomechanical changes to the body that lead to medical conditions, increased risk of mortality, movement alternation and compensations, joint loading, displacement, and decreased range of motion. There is a range of easily accessed treatments that can help to decrease body weight and restore diet in long-term perspective.